Hi everyone, I'm Dr. Janvi. In my last video, I talked about consequences of vitamin D deficiency. In this video, I'll let you all know more about vitamin D. Let me make it clear. Calcium and vitamin D are two different entities. If you take calcium supplements without taking vitamin D supplements, calcium, whatever you take, won't get absorbed until and unless sufficient vitamin D is present in your body. Let us all learn about the functions of vitamin D. Vitamin D got lots and lots of functions in the body. The three main important functions of vitamin D are regulation of calcium and phosphorus, which supports cellular processes, bone mineralization, neuromuscular function. It even helps in strengthening the immune system. It prevents certain type of cancers. It boosts your mood. It can aid in weight loss. It can lower the risk of rheumatoid arthritis. It lowers the risk of type 2 diabetes. It can help lowering blood pressure. It might reduce the risk of heart disease and reduces the inflammation and can also prevent upper respiratory tract infections. So, vitamin D is involved in most of the functions of the body. So, as I told you, consequences of vitamin D deficiency, what exactly happens because it is involved in all these functions. Now let's learn about the causes of vitamin D deficiency. Low dietary intake. If you're taking diet not rich in vitamin D, then vitamin D deficiency results. Low sunlight exposure. This is common in winter months and climates and latitudes where sunlight is limited, or people whose lifestyles involve more time indoors are also at risk for low vitamin D levels. Wearing a sunscreen of sun protection factor 30 or above 30 also causes vitamin D deficiency. Darker skin contains melanin which does not allow cholesterol under skin to get converted to vitamin D. Fat malabsorption syndromes like celiac sprue. Vitamin D is a fat-soluble vitamin. It dissolves in fat to get absorbed into the body. So if there is not enough fat getting absorbed, then there is not enough vitamin D getting absorbed into your body. Bariatric surgery is a gastric bypass surgery where stomach is bypassed from fat being absorbed. Vitamin D being fat-soluble vitamin cannot be absorbed. Nephritic syndrome. Problem in kidney where it washes out vitamin D into the urine. Medications like anticonvulsants and HIV increase breakdown of vitamin D without letting body to absorb vitamin D. We do a blood test to determine the vitamin D level. Vitamin D levels 30 nanogram per ml is considered adequate and healthy. 20 to 30 is considered vitamin D insufficient. Less than 20 vitamin D deficient. Greater than 80 is associated with toxic side effects. Therefore, low and excess of vitamin D is not good for your body. The best treatment for vitamin D is vitamin D supplementation. Daily recommended intake of vitamin D for infants under 12 months it is 400 international units. For people between ages 1 and 70, 600 international units. And for people who are 71 years and older, it is 800 international units. All newborns are supplemented with vitamin D drops as breast milk does not have sufficient vitamin D. Vitamin D is available in form of T-sol granules, vitamin D drops and tablet forms. Vitamin D is also known as sunshine vitamin because working for 20 minutes under sunlight before 8 a.m. helps your cholesterol under the skin to get converted to vitamin D. Sunlight and fortified dairy products are considered the best sources of vitamin D. Remaining sources contain a little amount of vitamin D, such as salmon, cod liver oil, sardines, tuna, mackerel, eggs, mushrooms, beef liver. Many of my patients in OPD ask me, is vitamin D2 or vitamin D3 good for the health? Vitamin D supplements are available as vitamin D2 and vitamin D3. Both versions can be used to treat vitamin D deficiency, but D3 seems to be more effective than D2. If a person vitamin D is very low and needs to be supplemented with high doses of vitamin D, that is concentrated doses of about 50,000 international units, then vitamin D2 is prescribed for a short period of time to get the levels back up to a normal range as it is readily available. But D3 is the most active form and it is the most effective form than D2. If there is excess of vitamin D in your body, lots and lots of calcium get absorbed into your body, and that results in excess deposition of calcium in kidney, where it results in kidney stones or kidney failure. Then excess of calcium or vitamin D results in excessive thirst, nausea, vomiting or abdominal pain. It results in confusion and hallucinations, muscle weakness and lethargy, heart arrhythmias. Therefore, when you go for vitamin D supplementation, first check your vitamin D level in your body, then go for the supplementation. Thank you all for watching my video. For any health queries, mail to inhealthforyou@gmail.com.